Welcome to the Helen Bader Foundation CBRF Caregiver Training Program. I'm Maren Meyer, and this unit is on the management and administration of medications in the CBRF. It's a very large unit, so we've divided it into a number of parts and units that have their own workbooks and videos. This is part 2, medication or drug actions and effects. We realize how important it is for you to have a basic understanding and knowledge of how medications work, how they're managed and administered, both for you as a person and for your residents in the CBRF. As I said, my name is Maren Meyer. I'm a pharmacist. I'm interested in public health education, and I've been teaching a medication course to CBRF caregivers since 1994. Although this is my first experience with videos, which you probably already guessed. I've written a couple of books on this subject. One is for pharmacists to help them in working with you, the caregivers, in your medication-related problems. And the other is called Coping with Medications. It has a lot of the same information that we'll cover here, and it has other topics of interest to elderly consumers. But right now, let's move right on into medication actions and effects. Now, each of our units or parts starts with a pre-test. There's a pre-test and a post-test. They are identical. There's no grading of these tests. The tests are there just to help you understand what you know already and give you an idea of what we want you to learn throughout the unit. Feel free to take notes in your workbook as we go along. You can stop the video if you get bored or if you get distracted, or if you just want to review information and then come back. But right now, stop the video, take the pretest, and then come back. Welcome back. Medication actions and effects is going to cover quite a few topics. It'll have a description of how drugs act, some of the factors that affect drug action, what happens to the body once drugs are administered, some of the common side effects and how to cope with them, and other unrelated, sometimes unexpected effects that we get from medications. We will touch on drug interactions also. Now, we may be referring to the CBRF rule that was at the end of your workbook in part 1, so you might want to have that handy. Also, I'll be using some of the terms that you learned in part 1. So if you hear words that are familiar but you're not quite sure of the definition, go back and review those, because it is really important to review information so that you'll retain it. Okay, let's get started. We can describe drug action in a number of ways. One way is the way we've described in your workbook. That is the general effect that the drug has on the body. In part A of the workbook, you'll see that drugs can depress, they can stimulate, they can destroy, or they can replace things that normally occur in a human body. Sometimes drugs have a number of these effects. For example, digoxin or digitalis slows the heart rate but stimulates the heart to beat stronger. Sedatives can depress consciousness and they can depress respiration. Caffeine and stimulants they stimulate cells in the body. Now, laxatives would stimulate every cell that they touched, and that's why they're coated so that they only stimulate the cells in the distant part of the bowel and cause the laxative effect. Antibiotics kill bacteria, not viruses at this point, and chemotherapy hopefully only kills cancer cells, although it does sometimes kill other healthy cells. Vitamins, insulin, and thyroid all replace naturally occurring substances that may be lacking in a person's body. Now, there are a number of ways that these effects can be altered. In B, you'll find a listing of some of these factors, and I'm just going to touch on some of the ones that I find most interesting. You should be sure to take time to read through the workbook, too. It's important to realize that drugs are usually tested on what they call an average person. Most of us would agree that we are not average. I mean, I'm not average. And your residents are not average either. Furthermore, the age and condition of people that the drugs are tested on is usually far different than the age and condition of people when they need the medications. Age, size, and sex are things that doctors have to keep in mind when they order medicines. Genetic factors can affect the way drugs work. Some people metabolize drugs faster or slower than the average person. As you learned in medication basics, disease states themselves can alter drug action. For example, liver disease could cause a drug to last longer in the body because it wouldn't be metabolized as quickly. Or kidney problems can cause the drug to build up and not be excreted in the body. These things are pretty unpredictable. So basically, what you monitor in yourself or in your residence is change. We monitor change in condition. You'll want to record any changes that you see or that your residents report. You just monitor those by writing them down in the section of your resident chart called the progress notes. This is information that's going to help doctors and pharmacists compare how your resident was doing today, for example, to how they were doing 3 weeks ago before a medication was started or before a dosage was adjusted. It's very useful information, and your role in this is very important. Emotional state can also be something that affects the outcome of drugs. For example, somebody who is extremely upset may not respond well to a sedative compared to a person who is extremely calm. Environment can also alter drug action. If you've ever had a headache and then tried to take something for it, sometimes you'll find that it works better if you're in a nice, quiet, dark place. To review some of the medication basics, the route by which a medicine is administered is one of the most important things that affects its action. You'll recall that it might take a lot longer for a drug to begin to act if it's given orally than if it's given, say, intravenously. But orally is generally the safest way to give drugs. Also, some drugs are going to last longer depending on how you give them. For example, if a drug is injected into the muscle, it often lasts longer than it would if it was injected into the vein. Time of administration can affect drug action. For example, we normally give prednisone, which is a hormone and an anti-inflammatory drug. We give that in the morning because that's when your body's normal levels are high. That way we're mimicking the body's normal rhythms. Likewise, when a drug causes drowsiness, we try to use that side effect or adjust dosing time so that we administer drowsy drugs at night when it doesn't matter if you're drowsy. The dose of a drug is one of the other most important things that affects drug effect. We need to keep a certain level of drug in the body for it to be effective. If there's too little, you may not have the right effect, or you may have a different effect. And if there's too much, the drug could be toxic or poisonous to the person. Usually we get the desired effect by evenly spacing doses so that as the drug is absorbed, distributed, and metabolized and excreted, just as that's occurring, we administer a new drug dose and we maintain the level just at the perfect therapeutic level, not too high or too low. I'm sure you know that food can affect drug action. Some drugs like Grispeg, which is for fungal infections of the nails, or Ceftin are better absorbed with food, while other drugs won't be absorbed at all if they're given with food. The best way to address interactions with food are to read those extra labels that the pharmacist sticks on those little prescription bottles, and also read the labeling that comes with your non-prescription packages. You can check your drug references, and you know your resources. You always can turn to your nurse consultant, your pharmacist, or the physician. If you recall from part 1, drugs are bound to proteins in the blood, and that's why we're concerned with the nutrition of our residents. Well, that's one of the reasons. When there are not enough proteins available, there may be too much free drug floating around in the body, so we may get a much more marked response from a drug than we expect based on the dose and the route that we gave the drug by. Another problem that we run into is that drugs are tested alone. Now, as you know, most of us don't take just one drug. For example, if you have a cold, you may take something for pain and fever, so that's one medicine. And then maybe you have a runny nose, so you take a decongestant, that's another medicine. And then maybe, well, you aren't sure if there's some allergic component to your condition, so you take an antihistamine, that's a third drug. And maybe you're coughing, so you take a cough suppressant. So suddenly you have 4 drugs, all of which were only tested by themselves. It's really hard to predict what's going to happen in that situation. And the more dangerous the drugs are, the more prescription drugs a person is on, the more unexpected things we find occurring. In section 12, there are a couple of really good examples. For example, using alcohol while taking sedative drugs, or taking 2 pain relievers like codeine and aspirin at the same time, or antagonism between 2 different drugs. Remember that a lot of the things that we consume every day are drugs, but we don't really think of them as being drugs. One example is nicotine. Another is vitamins, and both of those things can affect metabolism of drugs, they can affect absorption of drugs. So the safest thing is just to remember that any time that you increase a dose, that you decrease a dose, that you add or delete a drug, you can expect some change in the other drugs that a person is taking. Under C, you'll see that drug effects are the biological and physical changes that occur when a drug has been administered. The perfect drug would do only the things we want. It wouldn't do any other things, okay? There are no perfect drugs. All drugs have multiple actions. And the analogy I could give you is that, for example, the perfect drug would be like a sniper bullet. It would just hit that one spot that you want hit. What we have is more like a shotgun. It just sprays effects across a wide area. Now, before we think too harshly about side effects, let's see what they are and how we've been using them to our advantage. Minoxidil is a very effective blood pressure medicine. The problem with minoxidil was that it grew hair. And it grew hair not just on men and not just where people wanted hair, but it grew hair all over. Well, some enterprising soul saw that problem and turned it to an advantage. And now minoxidil is applied topically to areas where people want to grow hair. So I thought that was pretty amazing. A more common example would be codeine. Okay, codeine can cause pain relief. It can cause suppression of cough. It causes nausea, constipation, and drowsiness in everybody who takes it. But it causes these things at different doses for each person. Now, what might be a pain-relieving dose for you might be the nausea dose for me, okay? So it just depends on the individual. And for example, if a person who is in pain needs sleep, and we give them codeine and the pain-relieving dose also causes drowsiness, then we've used that side effect to our advantage. The local effect describes what happens when we apply drugs topically, and that includes not just creams, but also eye drops and nose drops. So how do we cope with these side effects? First of all, you have to remember that drug manufacturers are obligated by law to report every single side effect that is reported to them. And that's how you get these enormous lists of drugs that cause, for example, both diarrhea and constipation, or a drug that's used to treat headaches that causes headaches, okay? So those lists are usually just not useful to us, and that's why your drug reference should help you put things in perspective. What are the common side effects? And we have those listed in here in your workbook. But remember, we're always balancing the therapeutic or desired effect against the side effects or the undesired effects. As I said, side effects are generally just unavoidable, okay? And each person is going to react to a drug differently. Often the side effects are temporary. They may be annoying, but they're usually not harmful. And when a person starts new long-term therapy, usually we see that the side effects will go away after 7 to 10 days. But that is still something that you need to mark in your progress notes. Mrs. X started hydrochlorothiazide today, and then you monitor the individual. You just write a little note each day telling how the individual is doing, and then you would report any problems to your doctor. What can you do? You keep these good records. You report changes to the prescriber. That could be a doctor, a dentist, the podiatrist, or a specialist. Talk to your pharmacist or nurse consultant if you aren't sure how to act. Be sure to keep in mind that we can often avoid or minimize side effects by just simple dosage changes or changing the time that a drug is administered. And it's not like there's only one drug for any one condition. These days, there may be a whole host of drugs that would be equally effective and cause a particular individual fewer problems. There are a couple of categories of side effects. There are the obvious side effects, the subtle or not so obvious side effects, and side effects that we can only identify through lab studies. Okay? The lab studies are things we find by blood testing. That's, for example, some of the high cholesterol medicines can cause a change in liver's function, and we monitor that with blood testing. Tegretol, which is used for seizures mainly, can cause some changes in the count of white blood cells, and we monitor that. Some of the pain relievers can change kidney function, and we can actually monitor that by lab tests. In the residence chart, it's really important that you keep a list of drugs that need to be monitored with lab tests and how frequently those tests should be done. The best way to get that information is probably just call your pharmacist and they can help you out. Now, in the next section, which is section 4, under obvious side effects, what I'm going to do here is, rather than just read this entire list, is I'll just use a couple of examples. I'll start with aspirin. Aspirin can cause ringing in the ears if it's given at a high enough dose for most people. It doesn't really cause any visual problems, but it can cause gastrointestinal problems. It can cause stomach upset, and sometimes it can cause blood loss from the stomach. On the other hand, one of its other side effects is in the cardiovascular system. It actually can decrease a person's risk for heart attacks, and it can decrease the risk for strokes. And those are pretty nice side effects. Looking at the cardiovascular system, I want to use another example too, and that would be blood pressure medicines and also digoxin. Some of those drugs can slow the heartbeat, and then residents may complain of tiredness or drowsiness. Okay? They can cause fluid retention, depends on the drug, and it also depends on the individual. Because they're intended to drop your blood pressure medicines can cause low blood pressure, so you can get too much of a good thing. Low blood pressure can really increase a person's risk for falls, and so that's something that you would want to monitor and actually probably have in your ISP or service plan for the individual. All of these symptoms should be promptly reported to the physician. Now, in the nervous system, you almost always will see side effects from drugs that are intended to act in the nervous system. Okay? So, and those drugs would include things like sedatives. They would include drugs that are given for anxiety, or medicines that are, for example, used for seizures. They can cause drowsiness, they can cause stimulation, and they can actually alter a person's function. So what we're trying to do is to get that beneficial or therapeutic effect without disabling the person. There's no reason for people to have to suffer with side effects most of the time. One example of effects on the respiratory system would be, again, the sedatives, which do depress respiration. The sedatives, codeine can do that at a certain dose. And that's something that we wouldn't want to have happen, for example, in a person who has a chronic lung problem. Anytime you see a skin rash or swelling of the skin or any kind of skin problems, just immediately report that. Diagnosing is not something that we are all trained to do. What we're trained to do is to report change. And with skin, diagnosis is very difficult. Skin changes may signal a very dangerous situation. They may be minor, but they're usually very irritating to the resident. And like I said, there's no reason for residents to be uncomfortable from their therapy. One of the most dangerous effects that medicines can have, the drugs that are used for behavioral changes or for psychosis, for some mental illnesses, can cause a depressed ability to sweat. And if you'll recall, during the one summer that we had the very intense heat wave, a number of people died, and the largest percentage of those people were taking drugs for that particular kind of mental illness. The drug simply depressed their ability to sweat, and they just overheated. Some drugs that are used for challenging behaviors have sort of a characteristic set of side effects, and that includes things like blurred vision, dried mouth, constipation, retention of urine, and sometimes confusion. We call those anticholinergic side effects, and that's a word that I think you'll probably hear a lot, because many of the drugs that are given to our residents, particularly older residents, have anticholinergic side effects. Let's look at some of the subtle effects that affect the body when we administer drugs. And these things can occur from something that we use all the time and we think is perfectly safe. And an example of that is digoxin. A lot of residents take digoxin, and for most of the time it's a perfectly safe drug. But if you have an individual who suddenly becomes depressed or feels fatigued or starts to change their eating habits or has some swelling or complains of headaches or visual changes, you need to report those things, because digoxin is a very powerful drug. Some drugs can cause liver problems, they can cause blood problems, and we discussed those earlier. Under 6, side effects detected with laboratory testing. It's important, like I said, to have these marked in the resident's chart. We have a list of the most common drugs that need to be monitored through laboratory testing, and that includes digoxin, theophylline, dilantin for seizures, lithium for mood disorders, and Coumadin, which is an anticoagulant. If you're not sure, and you're not sure from your drug reference, call the pharmacy. So how do we manage these side effects? Well, first of all, you use your references, and you use your resource people. The other thing is to remember that side effects or any change in condition or major symptom needs to be reported right away. It might be a signal of something quite dangerous, and it also just might signal that we need to make an alteration to keep our residents more comfortable. The resident could be allergic to the drug, which is a very harmful situation. They may just need the dosage adjustment, and they may just be people who are going to always experience more side effects than beneficial effects from a particular drug. We call it sensitivity. And in that case, we could have the physician just switch them to another medicine that would give them the therapeutic effect without the side effects. Regardless of the reference you use, you may have a resident that experiences something, some unexpected symptom that you still think is related to that medicine. In that case, go with your instincts. Report it to the physician, okay? Write that in your note and report it to the physician. Now, the next page is really just for your reference. We'd like for you to just, maybe you want to post this. It's common side effects and how to manage them. We try never to use one drug to treat the side effects of another drug. Sometimes that's done, but it's best to use non-drug management whenever you can. Well, if the side effects section wasn't enough to scare the bejeebers out of you, we have more effects. These are called adverse effects. Adverse effects are the things we can't predict, things that just happen, okay? And while most of this information is information that you want to have a feel for, and as you read it, you'll learn it. Under allergy, I want you to sit down and look at this list and know all the items on this list. Know that skin rashes or swelling, fever, wheezing, shortness of breath, know those things are signs of a potential allergy, okay? An allergy is sort of like having a fire in the facility. You need to get excited about that only in the respect that you're going to be calm, confident, and competent, and you're going to immediately act and call a physician. You want to have your phone numbers posted next to the phone so that you don't have to look for those. I've been places where they didn't have that, and then we're looking for a phone book. That's not a time to look for a phone book or to wonder if the symptom is related to an allergy. You want to just know that information. There are also unusual side effects, just things that happen. And an example here would be children, when they take antihistamines, may get stimulated, whereas most adults who take antihistamines get drowsy. That's an unusual or idiosyncratic effect. You can develop tolerance to drugs. And an example of that is when you take sleeping medicine day after day, eventually your body will not respond to it in the same way. It may require a higher dose, or you just may not get sleepy anymore. Drugs can accumulate in the body. We talked about the problems with liver metabolism, with kidney excretion, and if the dose is too high for an individual, it may take quite a while for us to realize that. And digoxin is another really good example here. So always be a little suspicious. Part of your job is to be a detective, okay? To keep track of this information and to kind of weed it out, do some problem solving. Anytime you feel that there may have been an overdose or a person is toxic on drugs, you need to immediately refer to the physician. Now, I think in the popular press there's always a lot of talk about drug interactions. Drug interactions are hard to predict. They almost always occur. Usually they aren't harmful. A lot of this information is just going to be waiting there in case you ever need it. It's not going to be stuff that you're going to probably have to be walking around thinking about all day. We want you to be out having a good time and making the lives of your residents fun and comfortable, not just worrying about medicines, okay? But there are some drugs that very commonly interact. And under G in section 2, we've got a list of those. Well, if you notice that there's antibiotics, anticonvulsants, and it goes on, it's almost all the things that your residents take. So for example, if you have a diabetic patient who's been taking a medicine for diabetes and they've been taking something maybe for seizures and an antidepressant, and then they're put on an antibiotic and you see some changes in their condition that aren't related to getting well from the condition that they're taking the antibiotic for, you need to write those down in the patient's chart. You need to write down that you call the physician when you do that, and you need to write down the response that you got. Okay? That's the best way that you could safeguard your residents' health. Other effects that you may see are dependence. Now, dependence can be a problem. It can also not be a problem. For example, if a person has cancer pain, we don't worry about the fact that they may be dependent on narcotics. We want them to be comfortable. We try not to establish a dependent situation in people who are going to live a long time and then need these drugs. And an example of that is some of the anxiety drugs. A lot of times they won't be given to people simply because we don't want to establish dependence on them. But if they are ordered, you should go ahead and give them. The physician is going to be monitoring that. There's also a problem of drug abuse. Okay, we don't want drugs to be diverted, and that's what part of the rules are about, is to make sure that drugs are locked up safely so that they can't be abused, even accidentally. The most common kind of drug abuse is really drug misuse, and that's when people don't take their prescribed medicine the way it's intended to be taken. Now, fortunately, you're going to be helping most of your residents with their medications, So drug misuse will not be a big problem for your residents, and they should get the best possible effects from that therapy. What we're going to do now is we'll end part 2, medication effects and actions, with the post-test. If you recall, each pre-test and post-test are identical. They're not graded. They're just for your benefit to see where you came from, where you ended up, and what kind of information we want you to learn. And what I'd like for you to do now is stop the video, complete the post-test, and then come back and we'll talk about the answers. Welcome back. I hope it was easier the second time around. Now in this matching set, I'll read one column and then I'll tell you which item it was matched to. These are matching the factor that affects the drug action with the example that best describes it. Number 1 is food, and it matches best with F. Food can cause drugs or medicines to break down or fail to be absorbed. Number 2, liver disease, matches best with E. May affect metabolism or breakdown of meds or drugs. Number 3, stimulating, matches best with G, one of the ways that drugs produce changes in the body. Number 4, kidney problems, that matches with H, may result in med or drug remaining in the body too long. Number 5, route of administration, that's A. Change this to change the onset of drug action. Number 6, timing of administration, that matches with C. Adjust this to keep drowsiness from being a problem. Number 7, B. Drug may be ineffective if this is too small. Number 8, med or drug interactions. D. Hard to predict and potentially harmful. I've enjoyed being with you here in part 2 of the Management and Administration of Medicines in the CBRF. I hope this information proves useful for you and your residents, and I hope I'll see you again in part 3.